Good morning. Today is Thursday, the 25th of February, and this is our weekly COVID update briefing. We did not have a briefing last week because of severe weather. As of today, Bossier Parish has 12,944 positive cases, and unfortunately our deaths are at 259 in the parish. Governor Edwards has recently stated that the numbers of cases is at an all-time high, but that we haven't peaked yet, and it's going to get worse. He said the impact of the variants that are surfacing now is not clearly known, but they certainly going to be of a major concern for us as we go forward. The state's most recent percentage of positive cases is now at 11.30, which is plateaued, but plateaued unfortunately at a higher level than desired. Our goal is to be 5% or less. It was previously estimated that about 2/3 of all the states had a surge in the virus. Now, a little over 1 year after the first reported case of this virus, the deaths in the United States has exceeded 500,000. Almost unbelievable. Now, other variants of the COVID are emerging, and some medical experts say that the existing vaccines will be effective against these variants, but it does require more research and study. The Center for Disease Control indicated that the virus from the United Kingdom and South Africa are more contagious than the original virus. That means they transmit at a higher rate. They were resulting in more people getting disease, more hospitalizations, and unfortunately more deaths. It's speculated that the UK variant may become the predominant strain by March of this year. There have been serious problems in administering and distributing the number of vaccines, and then it's been compounded by the severe weather we've had this past week all over the United States. But the governor has indicated that we will be getting more vaccines, and we will be getting better prior notice of when we're going to get them, so we can more efficiently dispense those vaccinations. The Louisiana had previously announced the priority for individuals to receive the vaccine, phase 1A and 1B, and that have not changed, and I will not repeat those today. Then on Monday, February the 8th, Governor Edwards increased the categories for those eligible in certain categories, and that was to include persons aged 65 and older, first responders to serve as vaccinators, law enforcement and other first responders, dialysis providers and patients, ambulatory and outpatient providers and staff, behavioral health providers and staff, urgent care clinic providers and staff, and community care providers and staff. But just yesterday, the Louisiana Department of Health announced another group, categories of people that are now eligible in certain cases in select locations. And these are persons in the following categories. Again, persons aged 65 and older, and outpatients of dialysis providers and patients remain on the list, but added to the list are such things as law enforcement and other first responders, teachers and support staffs in K-12 or daycare, persons assisting the briefers with sign language and foreign language interpreters, and all pregnant persons, and then persons aged 55 to 64 who have an increased risk of illness from the virus are now eligible to receive the virus. Persons in those categories that I just ticked off are advised to complete the Louisiana COVID-19 vaccine attestation form before the appointment to receive the vaccine. The patient must contact the participating location to make an appointment, and they will not be given a shot without an appointment. while getting the first shot, you do not have to make an appointment for the second dose. It's done automatically, but the second dose will be administered at the same location as the first dose. The projection for when the general population will be eligible to receive the vaccination has slipped slightly and is now projected to be in the July and the August time frame. So it's also, I think, significant to remind people that you will not have to pay for the vaccine. The federal government has ensured that the vaccines will be available at no cost to the individuals. There is evidence that many people are still reluctant to take the vaccinations, but demand still exceeds supply. As previously reported, it takes about 75 to 85% of the populace being vaccinated to achieve herd immunity. And the effectiveness of the vaccine will be minimized if large numbers of people refuse the vaccination. And as previously reported, the estimate of people who are asymptomatic is about 50%. They can have the COVID-19 but have no symptoms showing it, but can infect others, their family, and others, and eventually cause more hospitalizations and deaths. The governor has previously directed, and it remains in force, that every individual in the state of Louisiana age 8 or older shall wear a mask covering the nose and the mouth inside a commercial establishment or any other building or space open to the public, whether indoors or outdoor, and this includes commercial and private modes of transportation. Also, the Center for Disease Control now recommends that children aged 2 to 7 wear a mask. The governor recently pointed out that the number of vaccines available is now approved and in the pipeline, excuse me, and is providing the light at the end of the tunnel for recovery from the pandemic. We got some good news yesterday that the Food and Drug Administration released an analysis of Johnson & Johnson's vaccine. Tomorrow, a panel of advisors to the FDA will meet to evaluate the vaccine and make a recommendation about whether it should be given the okay or not. If the agency does approve it and authorizes the use of the Johnson & Johnson vaccine, it would be a third major vaccine available in the United States. The Johnson & Johnson vaccine only required one shot and does not require special refrigeration for shipment or storage. An international study of some 40,000 people was conducted, and the company's vaccine was determined to be 66% effective overall in preventing moderate to severe COVID-19 diseases. The governor continues to urge that we be good neighbors and voluntarily and consistently comply with the prevention and mitigation protocols. If we're to get through this tunnel and get there with minimum loss of lives and its impact on our citizens and economy, we just need to follow those protocols. The Center for Disease Control and the Louisiana Department of Health have also determined that the number of days a person should remain in quarantine can be shortened to 10 days on day 11 if no symptoms have been reported during the daily monitoring period. They all go on to say that it can be shortened to 7 days on day 8 if the individual takes a test and receives the negative results. And it's hoped that these shorter quarantine periods will encourage more people to receive the vaccination. However, the Louisiana Department of Health still recommends 14-day quarantine for residents and staff of congregate living facilities, such things as nursing homes and correctional facilities. Ladies and gentlemen, the prevention and mitigation protocols remain unchanged. And as we do every week, I just want to remind everybody what they are. And they are as follows. Wear a mask covering your mouth and nose. Wash your hands at least 20 seconds. Social distance for at least 6 feet. Try to avoid touching your face and disinfect surfaces that are previously touched, such things as doorknobs, computers, handrails, and such. Cough into the bend or sneeze into the bend of your elbow. If you're sick, stay at home and follow the advice of your medical provider, and as always, avoid crowds. The governor continues to plead with us that we comply with the management of the mitigation and prevention protocols as being our very best defense against spreading the virus to our family, friends, and throughout the community. Ladies and gentlemen, the pandemic is far from being over. The vaccines are beginning to make a difference, but the challenges remain. It will take all of us working together to survive this pandemic. I want to once again thank you for your continuing participation in our joint fight against this deadly disease. Our next briefing will be Thursday, March the 4th. Thank you and good day.